You could be sore for a couple reasons, but here's my suspicion. As you change and as you age, as you lose estrogen, your estrogen and your hormones in general are very important to how you deal with exercise-induced damage to your muscle, meaning you try to tear the muscles down and build them back up. And if you're postmenopausal, this article will show what is happening. So this study looked at women and they did blood work after they had done their workout and several days post, and that they found that there is a significantly an increase in lactic acid and then the skeletal mRNA expression. You have increased interleukins, interleukin 6, interleukin 8, interleukin 15, and tumor necrosis factor, which translation, this is just all massive inflammation. So in postmenopausal women, if you are doing a high intensity exercise and you feel sore and you're not doing hormone therapy, and I'm not saying you have to do hormone therapy, but this is why there is soreness with postmenopausal women. The study found that there was a significant change in the mRNA expression of the interleukin 6, interleukin 8, interleukin 15, and the tumor necrosis factor. You're just more inflamed if you're postmenopausal. Because remember, estrogen brokers inflammation. As your hormones change, you don't deal with stress and inflammation as well. So this article concludes, postmenopausal women not using hormone therapy experience greater muscle damage after maximal eccentric exercise, meaning totally break it down, hard workout, indicating a possible protective effect of hormone therapy against exercise-induced skeletal muscle damage. We know hormones are protective. We know that estrogen helps us buffer inflammation. As you enter perimenopause, you become menopause. Postmenopause, you're more inflamed. Add this into we live in a COVID world, a post-COVID world, where COVID is an inflammatory disease. And if you've had COVID in the past 6 to 12 months, there's a strong chance you're just a walking ball of inflammation. Yeah. So this is why I talk about people doing recovery exercises more often. I do cold plunge, I do sauna blankets, I do mobility, I do restorative exercises that aren't very stressful on my joints. I make sure I am getting my full sleep, and I take omega-3s to help support me with my inflammation. Taking omega-3s is one easy way I can support my body to be less inflammatory. If that makes sense, nod your head. I know that sounds weird, but omega-3s are really important for us. So if you're looking for something you can do,